Welcome to Salute and Biohacking podcast. My name is Vanessa Bertinotti and my mission is to build an Italian-speaking tribe that share my same passion for health optimization and biohacking by bringing to the table experts and people who inspire me. All the information contained in this podcast is purely informative and does not replace medical or therapeutic consultancy. On this episode, I'm super excited to welcome Dr. Dominik Nischwitz, also known as Dr. Dome. Dr. Dome is a specialist in biological dentistry and ceramic implants. He is a functional medicine practitioner and one of the world's leading biohacker. Current is the vice president of the International Society of Metal-Free Implantology. With his father, he founded the DNA clinic in Tübingen, Germany. He regularly gives lectures around the world, and he has published the book, It's All in Your Mouth. Dr. Dome, welcome to the show.
Hey, Vanessa, thank you very much for having me. It's a pleasure.
It's a blessing to have you here, and thank you for accepting my invitation. Can you give us a little background on who you are and what you do?
So already my name is Dr. Dominik Nischwitz. Thank you for the intro. What I'm doing is basically, it's called biological dentistry, and I define it as the overlap of the high-tech dentistry and integrative for functional medicine and biohacking health optimization, which is actually your passion and mine too. So you could call me a health enthusiast, basically. So I traditionally studied dentistry back in the day, but calling me a dentist was probably not totally cutting it. So what I like to do is just basically look for new concepts, new solutions on how to optimize the overall body. And what we do is we start with the mouth. And because this is the entrance to your whole system. This is something that is a lot of times overlooked when it comes to problems starting in your mouth for the overall health epidemic, which is chronic disease. So I'm just looking for solutions to optimize everything: body, mind, spirit, the lifestyle, the nutrition, everything that is keeping us a very healthy and successful life, and just, to enjoy the beautiful life, basically, with a healthy body.
Great. I know for the people who listen to this episode, I'm really excited because you are a legend for me, really a hero. And so for me, it's important this episode because everybody should know about health in our mouths. And you change also my way of thinking. So it's important for me that everybody understand with this episode how important is our mouth for our health. And why helping people optimize their health is so important for you, where this passion came from.
I believe the passion is intrinsically motivated just by having had chronic health issues as a very young Dome. Around about my 20th birthday, I kind of crashed, got depressed, and I needed to find solutions back then because I wasn't accepting that I was depressed and that there was no solution. I was just like, I'm just not normal anymore. There must be something that can bring me back. So I was starting with the nutrition, with fitness, with performance, everything that I could find to kind of optimize my health. Back then, there was no health optimization. It was just like the medical field, which was the definition is still the same. It's health is defined as absence of disease. And I didn't want to be like labeled something or take any sort of medication. And I never did. I was just looking for solutions while studying dentistry. I was already interested in nutrition. I wanted to build muscle. I want to be as healthy as possible, while at the same time looking for solutions to bring me back to my balanced state. I was looking into supplements, nutrition, everything that you can find out. And it took me quite some years, let's say about 3 to 4 years, when I realized that just my neurotransmitter balance had collapsed from becoming a professional skateboarder and skating and just partying, eating the wrong foods. I just basically depleted myself. So I found this book, The Braverman Assessment, or it's called The Edge Effect from Dr. Braverman. And I took this Braverman assessment test, which I still use for almost all patients if they have any sort of issues up to this day. And I found out that I'm a dopamine dominant person, and I just had depleted the dopamine. So I knew from all the studies with nutrition and supplements how the biochemistry works, and I just took the precursors, and within a week my brain was back to normal, which kind of like set the foundation to see that there's even the next level. Because back then I just wanted to become healthy. Yeah, I didn't know about that there's optimal health, but I realized, oh wow, you can do so much with your body. And at the same time, I kind of started to be an assistant doctor and wanted to become a surgeon right after university. And my first boss, so to speak, was still doing the old school amalgam fillings. I'm a very aesthetic driven person, so a very artistic person. So I couldn't do unpleasing black fillings. So I told him, sorry, it's not going to work. I have to bring in the composites, the ceramics. I didn't know about the health side effects of amalgam back then. I just knew it's ugly, and my dad told me that I knew from my dad he wasn't using it because it's somewhat unhealthy. And then I looked into, obviously I had to know what I'm talking about. So I looked into heavy metals, found Dr. Dietrich Klinghardt, and the whole universe of integrative medicine opened up to me, which was perfect for the 5 years before when I learned everything on my body to basically heal myself. And now 15 years later, I'm on a mission to give back, basically just find solution systems that would have helped this 20-year-old Dr. Don see the light sooner. Because when you're like unhealthy, you basically just have one wish, be normal again. And yeah, if somebody could have told me back then, dude, no worries, you have to have your nutrition like this, those are the macronutrients, you depleted your dopamine, here's the test, we do some blood work, okay, this is the strategies you will do, within 4 weeks you're back to normal. That would have been a blessing, but I hadn't had that, so I had to learn myself, which is basically also a blessing, because otherwise I wouldn't be where I'm at right now, because this made me addicted and intrinsically motivated to find solutions for the many. And luckily, because I work with so many patients, I have a lot of knowledge and, most importantly, experience in the field, because I just execute it. And yeah, and so nowadays I'm just building systems and concepts and clinics, and yeah, basically I would say I'm a creator and a builder, and systemizing health strategies, starting from the mouse or whatever, and bringing this to everybody. This is kind of my love language, and this is what I love to do. And then connecting with other like-minded people to really make this a big movement. I call it health starting in your mouth. Basically, it's all about reaching optimal health on every level. So you see, it's been my half my life already, almost. So I'm now 39 years old, and it started with around about 21. So
yeah, so you have plenty of time to empower yourself and other people. So
I give my best.
And you train traditional dentists in biological dentistry. What is the concept behind biological dentistry?
Yes. So maybe traditional dentistry in a nutshell it's more based on the high-tech manual labor skills. So basically what we learn is to repair teeth for biting and against pain, and maybe for aesthetics and cleaning a little bit for prevention. But what we don't learn is that teeth are little organs, 32 pieces, kind of like an extension of your brain, like your eyes. They're connected to your whole nervous system. And because we do not learn these things, dentistry is still not really connected to the overall body. So biological dentistry brings it together. It's the overlap of, obviously you need to have the high-tech dentistry skills because there are people that still need repair, but it's kind of like the melting pot of this dentistry plus integrative medicine or functional medicine, which is a sort of medicine that deals with the whole body more holistically, and biohacking or health optimization, which is the same in my opinion, which is using cutting edge technologies, measurements, and basically quantifying everything to really see what's happening. And this is that's just the next level, because you have to see the traditional dentist has a bad rep, let's say like this. If you tell somebody you go to the dentist or you have to go to the dentist, more like, I have to go to the dentist. Hopefully you won't drill a hole and it's going to be that expensive and it maybe hurts. So I did a lot of research the last 2 years with my traditional dental colleagues, and they basically, the job sucks because you have patients that don't want to see you. You always have to bargain because they believe you rip them off, because there's this mantra of drill, fill, and bill as a dentist.
Mm-hmm.
And so basically you want to give your best, but you have, yeah, they see you the wrong way, like kind of like you would sell something, while you intrinsically motivation is always to help people, but obviously with a limited viewpoint, which is just dealing with biting. Yeah. Mm-hmm. And what we do is obviously you have to repair and fix the bite too. But for us as biological dentists, we look at the mouth as the mirror for your overall health. Mm-hmm. Because, for example, tooth decay is #1 chronic disease on the planet. So basically everybody has tooth decay, caries. Mm-hmm. And a healthy body is immune against tooth decay. So the idea of biological dentistry obviously goes further, because in the future, we shouldn't need a dentist that needs to repair teeth. It's just right now, because of the industry leading up to having tons of dental issues, that we still need to repair a lot. And we try to repair everything that has previously been done, mm-hmm. as biocompatible as possible. That means we look differently at materials that's being used. We try to, we always look for what gives you the best investment in optimal health. Where's the highest reward? Mm-hmm. So we look differently, not just for biting. We also look, is there anything that is maybe toxic, like metals, for example, the amalgam film? Do we have any sort of chronic inflammations, infections like root canals? Do we have cavitation? So we call that the oral interference, or let's say health hazards that might be chronically triggering your system in your body, that we can deal with. Mm-hmm. Kind of like
it's a paradigm shift.
It's a total paradigm shift, because we have to change the industry. So I always say, don't hate the player, hate the game. The industry, the conventional dental industry, it didn't really change. So what I learned in university, my dad told me back then, it's already outdated. It was outdated when I learned it. And this was just the technical side of things. So the technical things, like we're using 3-dimensional x-rays nowadays, we use ceramic implants, we use obviously all the most cutting edge dental stuff. So the technique gets better, but also there's so much information about the overall body that's so much, it's basically warp speeding. I believe information doubles every 6 months. Mm-hmm. And there's a study from Harvard Medical that shows that medical science is kind of outdated within 18 to 24 months. So wow. Basically, you cannot really keep updated, and at least you cannot in the university. So university is always just the entrance card. Mm-hmm. And the paradigm shift is that we see this as the entrance to your overall body and as a connection. And that we have to look at, okay, how can we prevent disease in the first case? Because health care is nowadays, it's more like sick care. And what we really want to do is, we don't want to get sick in the first place. And if we are, we repair it, but then look for optimal health. And obviously optimal health is luxury. It's an investment. You have to basically invest every day in different strategies that will help your body become as healthy as possible again. Kind of like when you came out of the womb, you're perfectly designed from nature. But epigenetically speaking, whatever the environment does with your body and your genetics for the couple of years will change your system and will change your body. And as you know, there's an immune system, we have a nervous system. And so you have to understand all these different modalities, and those things I teach. I basically teach everything around the mouthpiece. So I'm not the one who trains people in the technical side of things. Like, I'm not training you to implant a ceramic implant. I did that for a couple of years and explained everything. What I'm training is more the mindset shift. Okay, for now you thought about teeth as biting instruments as a dentist. Now see them as a mirror for your overall health. Is there a cavity? Okay, maybe you have a lack of nutrients. So I'm teaching nutrition. There's the food design concept. We're teaching micronutrients. We basically start by teaching the whole mindset shift, that you first of all learn what health or optimal health really means. And then obviously stress, immune system, detoxification, how is your liver working, what about your colon. So it's a whole functional medicine health matrix, lots of updates that you need as a traditional dentist. And also I teach it for patients. So I lately started I basically designed a course for everybody. You know my book, I know you read it and you've visited me, so you know what it's all about. But the courses, we did a beta course phase. It's going to be, it's just a working title, but maybe we call it the Blueprint to Optimal Health, starting from your mouth. And we did 15 days straight from early February to mid-February, every single evening with 20 people. And I designed a transformational journey for them. It's about 30 minutes a day where you will learn everything about the 80% that you as a patient or everybody can do themselves. Obviously, you also learn what is oral interference. This is what we talk about in this episode. But you will also see I can do a lot myself. So it's a mindset shift also for the patients. So the goal is that you understand that you take full responsibility over your body, and I'm just there to give you the solutions or give you strategies on how to reach it. So in order to see me in the clinic, as you know, you need to be quite committed for different things, because I want you to learn and experience everything and give you the maximum benefit on everything. Like, you know which levels are thought. It's everything. It's nutrition, it's lifestyle, it's mindset, it's awareness, and obviously it's the mouthpiece, because whatever you see in your mouth is depending on whatever happens in your body. For example, tooth decay is just a mirror of, okay, there's a nutrient depletion, there's maybe a lack of vitamin D3, maybe you're gluten intolerant. All these different research-based things are getting into a bigger picture. We just think outside of the box and don't narrow it down to just your tooth, but look at it as the whole universe.
And that's the way also the energy between the patient and the dentist change. So if the dentist see it that way and involve also the patient to be responsible for its proper health, then the energy also change, and the way of thinking and the way of going to the dentist also change, right?
Yes, I would say, is it okay if I say that you've met me? Like,
yes, of course.
Yeah, so Vanessa also is my patient, and you wait for the appointment, but you're kind of looking forward to meeting me. And it's like, when you come there, you're my friend on the health journey. I believe that we're all aligned, and that everybody who meets me or we see each other, we're on the same mission. We want to, first of all, heal ourselves. But with this acquired new knowledge, we change the world and help other people and inspire them. And yes, I have no single patient that doesn't want to come. It's really more like they apply to see me, and then obviously you're way more committed. You changed your lifestyle before, you ask for as much information as possible, and then the results will come. So it's best for both. It's a challenge. I challenge you to take responsibility, and then I give you the tips and tricks that I've learned, and with my best of knowledge, to help you reach the next level. And if I don't know further, I have other let's say other practitioners that I work with for next level things. So it's all about continuing the health journey, but I want you to experience and learn as much as possible when you meet me.
It's a win-win situation. It's doing like a teamwork, instead of giving to you all the responsibility, all the work to do, and I'm passive. So it's
in my opinion, it doesn't work. So you really have to be committed. You really need to, you have to decide your why first. Why are you going to see me? What is the outcome? And then it's win-win. Yes, we both work for the same result. And this is optimal health. And
great.
Yes, as you said, then it works.
And in biological dentistry, there is a chart that illustrates the relationship between teeth and organ. Every tooth is connected to a specific organ in our body. Could you elaborate on this fascinating concept a little bit more?
So this is the tooth meridian chart, or it's called odontone chart. Or it was invented by two guys from Germany, actually, Kramer and Voll, I believe in the 60s. And they basically did evaluate the connection of teeth with the autonomic nervous system through the use of electroacupuncture. And they found out that specific organs have specific connections, and also teeth are organs, so they are on the same, let's say, meridian system, or I would just say on the same autonomic nervous system. So for example, your incisors here are directly connected to your kidney and bladder meridian. This is more Chinese medicine. It's the autonomic nervous system. And obviously, if you have a problem here, it can also affect your kidneys, your adrenal glands. It can affect your whole system. And with this chart, you could also see the joints those teeth are connected to. You see the organs, you see different reflexes. You have to understand how the whole body works, and then you understand that there are different lines in your body. You talk about deep frontal lines, superficial frontal, back, lateral, and spiral lines. This is all connected. So it basically just shows you, okay, you had a problem on your tooth, maybe you have a root canal. You can look at this chart and see, okay, maybe this tooth is connected to my colon. Oh, wow, maybe my chronic gut problems are interlinked with my teeth. You just have to understand how it's all connected. This is why this chart is quite useful. It is always in traditional dentistry, it's always seen as quackery, and but it's just a different point of view. So I'm interested in all medical fields. I'm interested in Chinese medicine. I'm interested in Russian therapies, whatever. I'm not just doing allopathic medicine, but also doing allopathic medicine. Everything is. I believe nowadays we should use whatever knowledge and tools we have and build it together, and therefore even co-elevate everything. This is a very fascinating chart. We use it also, for example, what you could do is use a neural therapy with the chart at hand. Let's say let's go with this example. You have a canine that is a root canal treated tooth, and you don't know if it's like interfering. What we could do also is inject something at the spot. It's procaine, it's a neural therapy. And procaine is an anesthetic that dissolves at the spot, brings blood, and brings electrons, kind of like a reset button. We reset the system, and then I let the patient monitor or observe the whole body for the next 24 hours, not at the spot, but everything else. Could be that you sleep better, you can feel that you see better, like every minor change in your body will be observed and written down, and then you see, oh wow, this might be triggering my body and is a chronic stressor or oral interference. I always explain it like a splinter. Imagine you have a huge splinter in your arm, like a piece of wooden thing, and it's in there, and you remember when your dad has to take it out and you're kind of afraid, but you want to take it out, yeah, because you know there's an inflammation, there's probably bacteria. Same thing for dead teeth, like a root canal. They can be the splinter that holds you back from becoming superhuman. This is why we take out all oral interference to help with the nervous system, to help your immune system, to help with detoxification. So basically, we work on all the underlying functional medicine things by taking care of your mouth, but also obviously not just what we have to take out, but what needs to be taken in. That's why nutrition is so much of importance in our practice. It's about 80% is your nutrition, your lifestyle. And this is something that we teach. This is in the course. I want to teach you guys out there everything that you can do to be prepared, basically to be able to get into surgery, not just dental surgery, but every kind of surgery or repair every day. Yeah? This is why the course, I believe, will be so much of a benefit for everybody, because it's going to be onboarding for dentists, onboarding for the nurses, but also onboarding for all clients. As you know, if you meet or come to see me, you get an email with a lot of information and links and videos, and also PDFs about what to eat. Imagine you would also have a course with it, where you like really prepare, because then we kind of speak the same language when we meet finally in person. You're already aligned. So this also warp speed your healing. So I'm very much looking forward to when it's finally out there. And the first initial live course was really 100% results. So I was really fascinated. I did that live to get all your information. It's not about me. I'm not doing anything for me. I'm just giving back all the strategies for you guys out there. And if you help me with the right questions, I will try to provide answers and help you there. That's the idea of the live course.
So, and when this course will be ready for the next level? I mean,
I believe, so what we're going to do is, we filmed the live course. So the live course was basically on Zoom, like we talk right now, every day with 20 people, and according to a script that I have written. But obviously, as it was live, it was a bit flexible.
Okay.
And we will probably use this course for a little bit, and then to finally see if there's something that we still have to perfect in it.
Okay.
And then I would say within the next 3 months, we probably film it, and then it's going to be an online course available for everybody. And you will learn everything. After that, you know how to design your food, how to calculate the macros, which micronutrients are important, but also your mindset. And you will also learn everything about oral interference. So when you want to see a dentist, you at least be prepared with all the questions to ask, and you know. And for me, it's always important that the patients understand. Obviously, if you had dental repair done, at one point you might need to see a biological dentist to replace it. But to see me, you also take about 1 to 2 to 3 months of preparation. So being prepared always helps a lot. The 80% are in your hands, and because I don't want to be the guy who freaks you out with new information. It's like, oh, you have an amalgam film, you have to get that out real quick. Wrong. You have to change your lifestyle, help your body to prepare, get a solid strategy on how to remove all these metals, find the right practitioner. So you have time. It's all chronic stuff. We don't need to rush here. And basically, if you rush, most problems actually
come back, maybe.
Yeah, or come back or appear, or it's getting even more problematic. First of all, work on your body, help it to heal, and you can do so many things before you see the dentist. But obviously, at one point, this is what I wanted to talk. This is what I always want to bring out: is at one point you probably need to see a biological dentist if you had previous dental work done, if you had root canals, if you had your wisdom teeth removed, if you had metal fillings. This is something that needs to be taken care, but not without proper preparation. So this is why a course that teaches the overall matrix will help a lot of people, I believe.
Sounds great. Yeah, looking forward to it. Yeah.
Yeah, me too. It's really, I thought it was way easier. So it started 2 years ago when I thought, with Corona, actually, with COVID, I usually was giving about 1 to 2 weeks, every 1 to 2 weekends, I was giving a seminar for dentists about biological dentistry, because obviously I cannot help a lot of people, but if I train dentists, we can help more people. So I thought, okay, I'm going to write an online course now for not being able to do it in real life anymore. So I just wrote it for the dentist. And when it was ready, I wanted to film it. And then they told me, you built everything, but you forgot one thing. You need to market this. Otherwise, you just have to build it again. And I was like, okay, wow, I did that mistake so many times, just doing things and never talked about it and just having it. So I met 2 new people, and they really rolled it around. So we started by researching everything, and then, yeah, prepared. So because the focus was on how can we bring the best possible product for all you guys out there, to really help you transform. That's what it's all about. And you know, having met me, I'm the professor having too much information. So I funnel it all down for you guys so that, yeah, that it will help you. This is why we took so much time, researched so many different levels, so that I believe when it's finally there, it's really also going to be an evergreen that will last a while. Obviously, it's going to be with a community attached, and yeah, it's a whole movement thing.
And how did you find a way to balance the content for professional and for normal people? You know, because maybe dentists know a lot of more than people.
Yes,
and so.
it is more for normal people. But the most dentists, just to get a grasp of what we're doing, are also normal people.
Okay.
They don't know about the whole holistic concept. So actually, while I was doing the live course, I was realizing, oh, wow, it's the perfect course for the dentists too, because not all dentists are like me. Most dentists want to perform their skills, like the surgeries or the drilling the holes or the aesthetics. They don't have the time and the knowledge to explain all the functional medicine aspects of things to patients. So imagine they would use the course for their patients too. It will resolve so many issues for them. And and keep their minds not distracted by explaining about nutrition, which you really need a lot of experience. Let the expert explain the nutrition and all the 80%. So it will help them kind of like by public relations for the mission, yeah, because you learn about the problems in oral interference, but also what the people can do. So it's a lot of value in there for everybody.
Great.
Especially also for the nurses, because your whole team needs to be aligned. And most of the time, the dentist has no time to align the clinic because of having to work and make money from everything. See?
Yeah.
So,
and what about the breath? You know, we talk a lot also in my podcast about breathing with the nose, between the difference between breathing with the nose or breathing with the mouth, and why it's so important to breathe with the nose and not with the mouth.
It's various things. It's actually you're designed to breathe with your nose and have your mouth closed, because the nose is kind of like a filter for bacteria. There's air inside. Also, nose, the tissue in the nose is different. When you breathe through your nose, you have more NO activation, so there's strong antioxidants, but also the blood flow changes. Also, when you breathe through your nose, your whole palate, your whole sinuses, they basically widen everything. It doesn't really do it when you're grown up, but as a kid, it's really, really critical that you breathe through your nose, and you can see it already while breastfeeding. So breastfeeding is the perfect strategy, nature's strategy to help grow teeth in the jaw and the whole centerpiece. Because you can see when a baby is breastfeeding, it needs to breathe through the nose. There's no time for air through the mouth. And what it does, it opens up the whole insides, sinuses, and widens the palate and also the whole jaw bone to later have space later when you're 15 years old, 16, for your new teeth. So you prepare everything already as a kid. And what you see nowadays is as you change with your nutrition and you have tons of inflammation also in all these tissues, a little bit of bleeding, a little bit of swollen and tonsils and a lot of immune problems, people are starting to breathe through their mouths. And if you start breathing through the mouth, you obviously have no control of the bacteria that come in. You also have more of a dry mouth, less saliva. That means you're prone to decay, yeah, because your mouth should be closed. And then the saliva helps to nourish the teeth, but also the immune system works better. And you get less plaque, you get, just overall, it's just more natural to do so. But the mouth breathing is kind of a compensation mechanism for tons of inflammation in your body. If everything is swollen up and inflamed from your immune system being in aggressive mode, you can't get, and also obviously the tissue in your nose gets swollen up then, you just can't get air through your nose. You have to start using your mouth. And this will change your whole posture from like being aligned to like this. Yeah, they look stupid. And you also change, you can measure it too. Maybe as a biohacker, you probably know about mouth taping. You can measure it with your Oura ring. You can see that you need less respiratory. You have not a dry mouth. You don't have sabber out of your mouth in the night, and you overall just sleep better.
Yeah, I had all of this before. Now I'm mouth taping. I still mouth taping because otherwise I breathe with my mouth. But I had also dry mouth. I had also a problem with swelling, and so. And I can see it with our ring, so you're right.
Yeah, so it's just basically something that you would do naturally, but because our epigenetics are our lifestyle is so unnatural, it changes to adapt to tons of inflammation. Basically, it's just a sign of a lot of inflammation and lack of nutrients while growing up, that you have more narrow faces, open mouth breathing, because because when all the tissues swell up, it's just nothing comes in. So you need to have more air, because otherwise you die, because we need air and oxygen, as you know. It's critical. It's just an adaptation, and you have to relearn it, really.
So true, yeah. And you are a big fan of Weston Price. Who was Weston Price and what he found 100 years ago?
Yeah, Weston Price, I would say, was one of the first biological dentists. He was also an explorer and a nutritionist. And he has written the book Nutrition and Physical Degeneration. I quoted it quite a bit in my book too. So what he found out was he was interested in the physical appearance, not just the teeth, but also obviously the teeth and the body posture. And he wanted to correlate it with nutrition. And therefore he was seeing back then when industrialized, or let's say industrialized food started, like refined grains, gluten-containing grains, sugar, and conventional dairy, and all these new things that came up, that people were having crowded teeth, spacing issues, mouth breathing, lots of inflammation. So he decided to look for clues by traveling the world and visiting more indigenous people. So he went to see the Aborigines, he went to see African people, he went to see Switzerland people that lived more rural in the Alps, and took quite the amazing pictures of people that eat let's say a natural ancestral nutrition or diet versus people that already had their hands on all the new products like sugar, gluten. And he really saw what we see today. So he saw people that ate perfectly, were having white faces, big palates, big noses, no mouth breathing, all 32 teeth aligned, no scoliosis in their body, like basically perfect, from nature perfect. And then let's say their grandchildren had already eaten sugar while growing up, or grains, and they look like little monsters, very narrow faces, crowded teeth, lots of calculus, lots of inflammation, mouth breathing. Basically, they look like our teenagers nowadays, 100 years later in the Western world. And yeah, he said he was also the first one who designed protocols to bring back tooth decay. So an initial bone healing protocol, maybe. Just a legend. And yeah, what he found out was that our natural food supplies us with the most critical, let's say, fat-soluble vitamins and nutrients, vitamin D, vitamin K, vitamin A, and E, and obviously lots of protein and healthy fats and minerals to provide the material for strong teeth, for healthy bones, for a nice posture, and for beautiful gums. And yeah, this is something that is still not there. And as you know, you don't learn anything about nutrition in medical or dental school. You just don't. And this is what I teach this the most. So the food design concept is what I teach for dentists, for everybody basically, that in my opinion, that's the 80%. Yeah, if you have your lifestyle and nutrition covered, you don't get tooth decay. It's just impossible. This is why having a root canal in the first place is a problem. That's on you out there. It's not my fault. The idea is that root canals obviously are needed as a pain treatment, but you shouldn't need it because you took care of your health and don't lose teeth because you don't lose health.
Yeah, that's an interesting concept to develop also. For afterwards, we will talk about prevention also for kids and for the new generation. It's important to prevent.
In my opinion, this is what it's all about. Obviously, right now there's lots of repair to be done, because so many people had the conventional thing. But the future, at least for my kids, they shouldn't need to see a dentist in the first place. A dentist will be a very, very critical and important piece when it comes to overall chronic health optimization, chronic health issues, and then the health optimization, because you basically you have a unique point of view when it comes to overall health. By just having one look into your mouth, you can see basically the whole micro universe of the whole universe in there. You see dysbiosis, you smell it, you see toxins, various things. And yes, in terms of prevention, what we do, and I'm basically finding new strategies and solutions daily to optimize also the whole concept in the clinic. So we don't accept any patients anymore that just come in for repair. It's kind of like our clinic is more like a star restaurant. When you go to a star restaurant or Michelin star restaurant, you have to get a menu there. There is no to-go business. That's the same thing in the clinic. There's lots of menus with the focus on optimal health and also repairing your teeth the natural way. and you cannot come in for just a to-go, in this case, like just drill a hole and then go back. It's just not a dental office.
Mm-hmm.
You can say you've been there.
Mm-hmm. And if you have a bad breath, it's always an indicator that something wrong is going on in your body, or?
Yes.
Mm-hmm.
Yes, it's most likely a combination of various things. Can be your diet, and therefore a change and alteration in your microbiome, which starts in your mouth, but also gets transferred obviously in your whole gut system. And also obviously it's a sign, it can be related to all the repair work that you had done.
Mm-hmm.
If you have metals in your mouth, root canals, cavitations, periodontitis, you definitely have a wrong microbiome, and that's something that smells, obviously.
Mm-hmm.
It smells different. And you know, for example, just a root canal treated tooth, we know that there's bacteria inside there, anaerobic bacteria, which produce their metabolites. And those metabolites are sulfur containing, and they smell. Obviously, it's kind of like you have a rotten, you know, if you have a fish, for example, 2 days you have a package where there's the fish in, you throw the package in your garbage, and if you don't clean out the garbage, 2 days later it smells so bad. Right? This is just from organic waste product that appears. And obviously if you have something dead in your body that dissolves or kind of like rots in there, it smells. And this is something that we can change.
And you suggest to health professional and practitioner to do an oral assessment of their patient on day one. What are the oral interference they have to look for?
In biological dentistry, we always look for the major things is metals, root canals, and this thing called cavitation or NICO, FDOJ. And obviously we also look for the bite.
Okay.
And those are the 4 main things.
So starting from the basic silver filling or amalgam fillings, why they are so toxic for our health?
Yes, silver filling is a marketing gag. It is actually 50% mercury. You should call that mercury filling. Yeah, mercury is the most toxic non-radioactive element known to man. And in my opinion, it shouldn't be near a body or in the body. Okay. And the mercury, the amalgam filling, is still the main source for heavy metal toxicity in your body. Even though nowadays it's not possible to have a 100% mercury-free body because the environment is just loaded with it. We are not mercury-free anymore, but it should be in your tooth, in your system, intoxicating yourself 24/7. And as a dentist, when I remove it, I have to bring a special device to get this toxic waste away. So I was thinking back then, wait, I have to remove this stuff as toxic, highly toxic waste product. How can I put that into patient's mouth? Besides the ugly side of it, because it's just nasty and not aesthetically pleasing, it is really toxic. And the most critical thing is, and I always remember, don't go to the dentist and get it just drilled out. You need to find a special one because you have to remove it under safe protection. Otherwise, you make it worse.
And why is it so important to remove amalgam filling safely?
Because of the mercury vapor. So you have a little bit of mercury vapor gassing out of the amalgam filling every day. It's about 2 to 3 micron per filling. So millions of grams. So really, you don't see it. You don't smell it, you don't see it. It's just the Hg0 in chemical words. Okay. But when you drill it out, obviously, and you don't know how to, because that's not something you learn in university, and you just drill it out like a regular filling, you have tons of more, like you have a 100-fold of mercury vapor that can intoxicate you on this one little incident of removing the filling. And I had so many patients that had their chronic health issues started right after removing off the amalgam filling because of more mercury vapor. And the mercury vapor is so toxic, it just goes into all your cells. It goes through 7 layers of gloves, and it goes everywhere. That's why it's so critical to be prepared when you remove it.
So it's bad for the patient and it's bad also for the dentist, right? Yes,
yes. The dentist is actually, dentists are not having removed the amalgam once in their lifetime, they do it every day. So for dentists and nurses, it can be a lifesaver. And it is a lifesaver because they're chronically intoxicating themselves on a daily basis and don't even know about it. And then they worry. There are studies showing that the pituitary gland of dentists is full of mercury. And this leads to all sorts of alterations in the whole biochemistry, maybe also in the psyche. And every metal is connected to inflammation and cytokines are connected to poor levels of neurotransmitters. Cytokines are connected to depression. So whenever symptom you're experiencing, there might be a connection to something in your mouth.
Yeah. And how do you find certified dentists that are using the right protocol to remove amalgam safely?
So unfortunately, we didn't, so there are not too many that are fully trained by us. So we have a curriculum with the ISMI that is called Becoming a Specialist for Biological Dentistry and Ceramic Implants, which is basically the entrance for the technical side. All these people that we examined, they are doing the high-tech dentistry. So the way that I would be able to go see them and do it for myself.
Okay.
They maybe are not as advanced when it comes to the other pieces, the integrative medicine, the blood works, the nutrition, the micronutrients, but they at least know about the food design concept and the boning protocol, and they at least will remove your metal safely. So you have to find them. I can give you a link where you see them if you want to, for all the specialists that we trained. And then there are a few certified programs worldwide. So there is this, let's say, a sister body of the ISMI. It's called the IAOMT. It's more the national organization. I don't know how it is. And the IABDM. There is something called SMART Certified Dentist. It's more in the US, but there are a few in Europe too. SMART means safe metal removal protocol. SMART, like smart. If you find people that are SMART certified, they will also remove your metal safely. I haven't trained them, but I know that they use basically the same protocol.
Great. So I will give all these links at the end in the show notes. And root canals, what does it mean to leave a root canal in the mouth, and what consequences can it lead to?
So a root canal basically needs to happen when you have pain. When you had a huge cavity and bacteria were able to go inside your nerve, which is the root, in the root of the tooth. So what a dentist will do is basically take out all the vital parts of the tooth, kill it, so to speak, and place something in this root canal to fill it up. It's called a root filling. So it's initially just a pain treatment, and it's very much needed if you're in pain. It's a acute pain treatment, and you need this. And obviously there are very skilled dentists, and they're called endodontologists. Those are the specialists in root canal treatments that do it way better. But from a biological point of view, and this is my specialty, we only see it as a temporary. We don't use it for the long term. Why? Because it's now a dead organ, and maybe if you had a very good skilled dentist do it, it's quite sterile for a couple of days, months, maybe years. But bacteria that live inside your cavity, in your oral cavity, can just go in there, or maybe already are in there. And mostly those are anaerobic bacteria that you don't want to have in a cave. So this tooth over time gets just chronically infected. If you have an infection, you have an activation of your immune system, if your immune system still works. The immune system will produce cytokines to help fight the infection, and produces a chronic inflammation. You see that on a three-dimensional X-ray most of the time as something on the tip of the root, like a cyst, for example, or just a bigger periapical lesion. And this is just a sign of chronic inflammation. And as we know in functional medicine, chronic inflammation is at the forefront, is one of the biggest factors to chronic disease. And you can, whatever symptom is possible. Chronic disease means chronic Hashimoto thyroiditis, it can be depression, it can be irritable bowel syndrome, chronic fatigue, you name it. Whatever symptoms you're experiencing, a chronic inflammation is a big culprit. So you have toxins in you have bacteria, they produce metabolites, those are toxic. The immune system can react to the tooth by building a cyst, or just by becoming allergic to the materials used. So, and also the third thing is, it's a dead organ, so it will rot over time and produces putrescines, cadaverines, other major toxins that should belong underneath the earth and not into your oral cavity. And if you now know that teeth are connected with the trigeminous nerve, with your whole autonomic nervous system and your brainstem, you know that all these cytokines, toxins that are in your teeth or in your root canal are traveling through the nerve inside your system 24/7. And this obviously can have detrimentous problems or consequences on your overall health.
And now
and you might not even know it, you probably don't even feel it at the spot. That's the problem.
Yeah. So it's important. Maybe you don't even have pain, right? No.
Most likely I see patients that have huge cysts on the cone beam for years, and I was asking, wow, how can you compensate? It does not hurt. And it's like, no, it doesn't really hurt. And this is the problem. The dentist just asks for pain. So they ask him, does it hurt? No. Okay, then we just monitor it for the next 6 months. And if it doesn't hurt, we do it again. So you're having a chronic issue that might deplete your body over the long run in your mouth. You don't even know that it's related to every symptom in your body.
And you talk about nerve. I recently did an episode on my podcast about the vagus nerve. Why, when having any oral interference, the vagus nerve is always impaired? What is the toxic vagal syndrome? So
yes, the vagal nerve is it's basically the major parasympathetic nerve. So we have a sympathetic nervous system and a parasympathetic nervous system. Sympathetic is fight and flight. You run away from a saber-toothed tiger, and parasympathetic is the nervous system that is for rest and digest. The opposite, repair, digestion, everything. And it gets activated through the night. And the vagal nerve is also a brain nerve. And a few fibers of the vagal nerve always run together with the trigeminal nerve. And the trigeminal nerve is also one of the 12 brain or cranial nerves that is, it's basically the teeth. The trigeminal nerve goes from here. There's a lower part, which is called the alveolaris inferior. It's connected to your jaw, to your lower jaw. Then there's a mid part, it's connected to your upper jaw. And there's a top part connected to sort of your sinuses and frontal sinuses. And if you have a problem, let's say toxins or infections or cytokines that are on your teeth or in your teeth, they are connected to your trigeminus. So the trigeminus transports it. And if you know that trigeminus is directly connected to the vagal nerve, you now know how it's possible to get a toxic vagal nerve. Could be from an ongoing inflammation like a root canal or a cavitation in your jawbone. Because if you have toxins here inside your bone surrounding those nerves, those toxins will be transported by the nerve. It's called retrograde axonal transport. And if you have that ongoingly, there are people that are having toxic vagus syndrome. That means they basically cannot get out of fight and flight syndrome. They are in stress mode 24/7 for 10 years, 20 years, 30 years. They never rest and repair. They have no immune system. They have open doors for chronic infection, for viral, for everything. And this can be a big problem.
Wow. And can you talk about your process when it comes to extract the root canals?
Yeah, obviously the goal is to keep the anatomy perfect. So the tooth is already dead organ, it's dead tissue. So we will take it out very, very, very gently. So no teeth ripping here. We don't break our teeth like you believe the dentist does. We take it out very, very gentle to basically preserve the whole socket. If we remove it, we then use elaborate protocols to disinfect. We use ozone and we use neural therapy. And also because my goal is to restore that teeth or replace it immediately with a ceramic implant, I will also drill into the socket. And most of the times underneath the socket, there will be a huge cavitation or a spot, an osteolytic process where there's tons of inflammation in it. So we will clean the whole area of everything that is chronically disturbing and then place an immediate ceramic implant just to preserve this socket. The socket is the part where you took out the teeth. Because if you don't replace it immediately, what happens is within the next 3 months, what the regular dentist does, we just wait to let it heal, and the socket where the tooth was in would just collapse. If you have something in there, like an implant, it just stays the same. So basically the implant is a trick to make the body believe that there is still a tooth. And as we use ceramic implants, we don't produce any sort of inflammation because the ceramic implant is totally neutral. So in my practice, even though I'm a specialist in ceramic implants, it's never about the implant. The implant is only one bonus we can use to help your body restore the bite and restore the anatomy and help it. That's why it's called a bone growing device, those implants. So we are using everything that's possible to restore the socket. And also, obviously, if you immediately implant, you never have a real extra surgery. It's all in one.
Yeah, you call it the all-in-one concept, right?
So the immediate implant is called shortcut concept or accelerated concept. And I learned it from Dr. Ulrich Volz, who is also the inventor of the ceramic implant company I'm using, and with whom together I'm the vice president, he's the president of the ISMI. So we are training the dentists, and he's more the guy who trains the specific, the hands-on training, because he is the artist behind the ceramic implants, let's speak. And I was fortunate to learn from him and his experience, and within the last 10 years, I placed way over 4,000 ceramic implants. So that was actually very, very important for my mission to become very good at the high-tech dentistry field, because ceramic implants was also a woo-woo thing. So it just within the last 3 to 4 years, it got finally accepted by the dental colleagues. 99% of all dentists still place titanium implants, which are not allowed in biological dentistry because they are, again, metals and which can interfere. So becoming one of the #1 leaders in ceramic implantology I was able to basically bring in my knowledge about nutrition, about IVs, about micronutrients, and all the health optimization structures into dentistry. So I was very fortunate to make it this way, because otherwise they wouldn't have listened at all. So it took a while to get that on every level, but now, they call me a leader in biological dentistry. So I have to give my best anyways.
And why do you use exclusively ceramic implants since 2013?
Yes, exactly. That's because I just back then I had my concept ready. That biological dentistry concept was there. I knew, okay, I had to have all the oral interference to be taken care. So I knew how to replace amalgam filling safely. I knew about the cavitations, about all these things, but there was, I didn't know how to replace a missing tooth, because I'm a surgeon. I'm an implantologist. So I was trained to install titanium implants. When I met the guy with the ceramic implants, I could use it as an all-natural tooth replacement. That's why from that on, the system was working and I never changed. And I actually also never tried any other company. It just worked. So good. I'm very loyal.
Good. And so you talk about amalgam fillings, then root canals, and now cavitation or NICOs or FDOJ. What they are, and how can you see if a person has cavitation in their mouth?
This is the third topic, or the third health challenge in your mouth. And the problem here is that this is something you don't learn in university. It's just not medical science yet, even though it is. It's just not in the curriculum that as a dentist. What it is, cavitation is the layman term for the thing called NICO, or better FDOJ. It stands for fatty degenerative osteonecrotic jawbone. And the specialist in this field who basically did the most research work is Dr. Johann Lechner, friend of mine. I call him the Yoda of cavitation. He does that for 40 years, and he has 15 peer-reviewed papers. And basically, whenever we take out a tooth and you're not prepared when it comes to nutrition and your lifestyle, your body gets into a shock system and it's not really able to repair the damage, the socket. Why? Because it has a lack of vitamin D3, of critical nutrients. You maybe caught the patient in hibernation mode. So it was just not anabolic enough to rebuild it. So what forms is a cave. It basically, the body just healed the gum on top and maybe a little bit of the outside bone structure, the cortical part. But inside, where we need sponges, healthy bone, there's no bone. There's basically degenerative fatty tissue And what Dr. Lechner found within that stuff was like, it's kind of a dumping area of toxins, heavy metals, viruses, mold, fungi, parasites, whatever, and it needs to be taken care of. So in order to prevent it in the first place, you should be prepared for any sort of extraction. And most likely the teeth that are extracted the most in the Western world are wisdom teeth. Why? Because we don't have space for our teeth. So regularly, let's say in 80% of all cases, teenagers will go to the dentist and they will just take out the wisdom teeth without preparation. That means teenagers growing up, anyways, maybe smoking, maybe drinking, maybe you don't have any sort of lifestyle, vitamin D3 deficient, just gets a huge traumatic surgery, swollen up cheeks, your body's just in a shock syndrome, cannot heal it, and then you develop these cavitations over time. So in order to prevent it, it's the same protocol as we do in order to clean it out or make it again healed. Because it's a chronic inflammation, your body is used to it. You don't even feel it most likely at the spot, and your body can't do anything there. So you have to make it acute again. Acute means I have to do a new surgery, clean it out, obviously a very minimal invasive surgery, but make it healthy, clean it, use ozone, neurotherapy, membranes for your blood, and then your body, because it's prepared, is able to finally heal it, and then we have nice bone later on. Mm-hmm. So
in my case, I had the 4 NICOs to clean, but you extract my 4th wisdom teeth. So it was the other way around. I mean, I didn't have amalgam, I didn't have canals, I had NICOs, but why you extract my 4th wisdom teeth in that case? If you can explain.
Before the wisdom teeth had to go, and also you had the cavitations surrounding him. Mm-hmm. And this is more like a, let's say, not Neanderthalic thing, but 10,000 years ago, all of us had 2 pairs of wisdom teeth.
Okay.
And what you had was the dental bud. It's kind of like this, let's say, the seed of a tooth. It's called a dental bud. It's tissue that is in there in order to build a tooth. And if the inflammation to build a tooth doesn't happen for whatever reason, because you don't need it, this tissue in there gets necrotic too. So you had a huge cavitation surrounding it. And also the wisdom teeth, I believe, were not as vital anymore.
Mm-hmm. And about prevention, how do you prevent tooth decay? What are some biggest mistake and myth that you see in your patients?
Tooth decay, how to prevent?
Yes.
Is 100% lifestyle based.
Okay.
So it's about, it's again a combination of which nutrients do you really get from the body and which ones do you eat on a daily basis that inflame your whole system and you cannot uptake critical nutrients. So it's always a combination of inflammation in your gut, leaky gum, gluten intolerance, and therefore minerals getting chelated before they even reach your system. On the other side, just a lack of vitamin D3 and other critical nutrients because your nutrition is basically not nourishing you and not building your teeth from within. So lots of insulin production, lots of simple sugars. And it's not just the sugars, as you know from a dentist, that will lead to the cavities. It's the whole biochemistry around it. Obviously, sugars will trigger your insulin and change your saliva and your pH. But it's about, it's about an unnatural lifestyle and nutrition. The standard Western diet is unnatural to us. It's really convenient and it tastes very, very good. It's hyperpalatable foods, but it's most likely produced out of things I call the core 4, gluten-containing grains, sugar, highly refined oils, and conventional dairy, and maybe a mixture out of it, which then over time will deplete your stores and your teeth will get weaker.
Mm-hmm. And what about the key vitamin you were talking about and minerals deficiencies that people usually have and do cause oral health issues? So what are the main vitamin and mineral deficiencies?
So the number 1 deficiency is always protein deficiency, and therefore a deficiency in amino acids. Those are the tiny particles. You basically need them for everything. Protein is the building block of life. That's a macronutrient, healthy fat. But then when it comes to micronutrients, number 1 is probably vitamin D3, which is a hormone produced by the sun. And at least in Germany, you don't have sun for 6 months of the year, so you're quite depleted. and you need vitamin D3 to uptake calcium and other minerals into your bones and cells. So there are a few cofactors like magnesium, vitamin K2, zinc, all these critical minerals and vitamins that you need. And of the fat-soluble vitamins, it's vitamin A, vitamin D, vitamin K, vitamin E. All these are very, very critical in order to build. It's the whole biochemistry. You shouldn't have a lack of nutrients in the first place. And then also there are so many different mindsets. And I know vegan diet is a very big trend right now, also obviously due to films like The Game Changers on Netflix or Seaspiracy. And a vegan diet is not foolproof, let's say like this. You need to know exactly what you're doing and how to prepare plants to be able to get the nutrients from them.
Yeah. And how do you remineralize teeth? What is the solutions?
It's a two-way street. It's from the nutrition, so everything that you absorb through your gut and then gets absorbed by your bloodstream and then goes into your cells, but also from the saliva. It's again both. So the saliva is kind of like let's say a miracle fluid that contains peptides, it contains your immune system, it contains minerals in a very very precise pH level. So the saliva is there to replenish and remineralize your teeth after your food and nutrition. And on the other hand, everything that you absorb from your correct food, nutrition design, will help to build teeth. And it's what I said, it's amino acids, it's the fat soluble vitamins, D3, K2, magnesium, zinc, the basics basically.
And before coming to your clinic in Tübingen, your patient have to be prepared. You talked about this before. Can you explain what is your approach and your main pillars again, maybe?
Yes, the preparation always starts, it's depending on how good you're already prepared, but let's say 4 to 6 weeks prior with a change in your nutrition. I call it the food design concept. And to make it very, very simple, there's a red chart and a green chart. The red chart means all the stuff that you shouldn't eat because those are the most pro-inflammatory foods. I don't want to have any inflammation in your body that comes from nutrition. So you will skip gluten, no sugar, no dairy besides butter. And by dairy, I mean no conventional dairy. Raw A2 dairy is a different story. And no refined vegetable oils. And basically all the products out there are forbidden before. And then the green chart is the macronutrients. Therefore, I teach thinking in nutrients. It's protein, healthy fats, healthy carbs, vegetables. And before, I cannot give you a one-on-one consultation, but you will know about 80-20 what you need to do. Protein, about 2 grams per kilogram body weight. And then we design your nutrition more like you would hunt. You could hunt it or fish it or collect it. And prepare your body with this. On top, I have designed the bone healing protocol, which is basically let's say a very well-rounded micronutrient protocol, but also there are macronutrients in there, amino acids, collagen, different proteins, and it's based on high levels of vitamin D3 because I want you to be immunologically boosted and relaxed and anabolic when you be in the clinic let's say after 4 to 6 weeks. Why? Because I need to do a surgery and I can only morally do a surgery when I know that you are prepared and you will heal it. Therefore, I will also teach you when you're there what you need to do for the next 4 to 6 months in order to heal, because it's not about the surgery. The surgery is needed, but it's only one day, it's maybe 2 or 3 hours. But what about the next couple of weeks and month in time? It's all again on you, where you will know exactly which nutrients you will need to eat on a daily basis so that your body is able to build. That's called anabolism. I want you to be able to build your body, and therefore bone, teeth, tissue, gums, and everything else comes with it. Again, that starts in your mouth.
Great. And I would like to talk about your boys as parents. You are a father of 3 boys. What do you recommend to parents? How they can prevent their children from having tooth decay or oral health problem?
Yes, it's again about your lifestyle and nutrition. Okay. And I teach my boys nutrition every single day because it's about repetition. Obviously, all the kids will love the sweets. They get addicted to sugar and gluten and all this stuff in a minute. It's kind of like giving an adult alcohol. They cannot willingly choose not to. So you have to have rules in place. And I would just make sure that they learn what builds the body. So they know about macronutrients. I just train them. I tell them what is protein, and I look for the patterns, what they like more, what they like to eat more. Obviously, my kids are very, very active and healthy. So they eat a lot of food. They eat healthy carbs, they eat fats. I just look for a well-rounded nutrition. And obviously, they're also allowed to eat a few sweets here and there. I just limit it. And if I can, or if we can, we give them, we prepare. And so when they're in kindergarten or in school, they always bring their own food. Because the most critical years when it comes to development are actually the first 20 years until you're finally grown up. And whatever investment you can put in there, and you don't have to be perfect, that will build a healthy body for them. And for my kids, I can see it in a second. If they ate too much sweets or if they ate too much gluten, they just flip. They get unbalanced, they get aggressive, they don't like themselves anymore. They just, like when you have a hangover. I don't want my kids to experience it, but I also try to give them real life experiences for it so that they really see and feel what happens if they, for example, eat too much gluten when they don't tolerate it, or too much sugar. What will happen? Because then if they feel it, they might be getting the lesson easier. So it's all about this. And obviously my wife is really, really good when it comes to nutrition for kids, making healthy cakes, healthy treats. So we have a lot of strategies there. So you should definitely follow Steffi. You do, I know. Yeah. Steffi and the boys, because she is doing the lifestyle with the kids and the women. And I believe this is the most critical thing. Kids are just tiny human beings. They don't need a kids menu. They eat what's on the menu, and they have to eat the fish, they have to eat the meats. It's just about the story that you tell them. If you think, oh, those are just kids, they need to have their Nutella for breakfast. No, they don't need to. So there's a few critical things that we don't do at home. No Nutella, no fried stuff. So fried stuff is really forbidden. There's times when they eat an ice cream, which obviously is made from milk and sugar, no problem. It's a balanced approach. I want to have them a very nice childhood, but I don't want them to be stupid about it, because I just know. My parents didn't know, and I don't blame them for it. So I just basically ate what I like to eat. And obviously the nutrition or the food that we get out there is not really designed for us human beings. So I try to make it just better, but not perfect. I don't perfection it. Just and also I give them a few supplements too. So whenever it's all about strategies. I meet so many parents and my wife that really don't know what to do, and it's really, really critical that you empower yourself. And this is what the course is also about. If you know about the course, then maybe I also will bring in Steffi at one point to upgrade, to make it even more appealing. Because funny enough, most of the following I have are females. It's like 8% female. In the course, in the beta course, was 20 females and 1 guy. Right? Yeah, but it makes perfect sense. There are not many men like myself that do all these things, because men most generally have a strong ego and they don't want to accept that they might not as healthy anymore. So they will always say, no, I'm fine. But the wife most likely is the nourishing part of the family and takes care of the kids to grow up, and also of the husbands. So most likely females come to me, and then they bring in their men. When the men see, oh wow, my wife changes, they need to catch up. It's like, you know what I mean? So not many men are like that. It's only because I had my health issues. Otherwise I wouldn't have learned. Why would I? Yeah, why? I had problems, so I had to find solutions. And I'm still doing it, and I love it. I'm a big experimenting guy, so I want to try new cutting edge things on a daily basis. I'm very interested in all things that develop. I read every book about nutrition still, even though I do it for 20 years, and I probably read everything. There's always a little detail. I test it on my body, and then I can see and improve you guys and help you. So same thing for Steffi. Steffi does the same with me for 20 years. That's how long she's my wife. Like my girlfriend. At the beginning, not my wife, but now she.
You are loyal. We understand that you are loyal in everything, and current. You know, I think it's important. Current, discipline, and those things for you are a big point. I have a question about children, because with adults it's difficult to make them understand about lifestyle. They have to have a big purpose to follow and keep believing this lifestyle. But with children, how can you make them understand that they have to eat differently compared to their friends? Because I imagine that their friends that don't eat like them, and usually kids compare a lot. Why they do that way?
It's difficult, and so for me, it's like I train them on a daily basis, and we talk about this, and and I really try to teach them things. And for now, it's like that my kids, when we go to a vacation and they meet people that eat normally, like other kids. I can just give you my last vacation where we went to Egypt to a club. I never been to a club before, so there were tons of kids, and there was Max, another Max, and he obviously wasn't eating like our Max. But what my son did was, Dad, can you not help his parents and him to also learn how to eat correctly? I believe he does it not good. I believe he does it wrong, and he could improve. So he's already on that mindset that he sees the difference. Because
how old is Max? How is your Max?
He's already 7, so he becomes conscious a little bit.
Okay.
So he's 7 years old. But also Carl is only 5, and I try to give them real life experiences, because we live that lifestyle. For them, ours is normal.
Yes.
But if they obviously see and compare that they eat only crab foods, and why are they allowed to eat pizza every day? And then I explain to them, do you remember the time? Do you remember this little kid with the nasty black teeth? Yes, I do. That's from food. Do you want to be a superhero, or do you want to be a little pig?
Okay.
I give them real life experiences, and then also at times I let them go through it, like have the inflammation in the belly. And when they're inflamed here, they cannot do the push-ups anymore. So they're like, what's happening? See? Or their brain, they hate themselves for one day and they don't know what's happening. And I tell them, you basically just went to a birthday bash and you ate sugars the whole day and stuff that you're not designed to. Therefore, your neurotransmitters are off. I just talk to them like that, like normal, like I talk to you.
So you make them live the experience of the normal
Yes,
food.
always. And especially when they have the experience, then I go in and teach them the lesson.
Yeah.
And if they get the lesson, I hope so. But obviously, you have to be a bit controlling here. Why? Because the stuff that that they can have, like all the designed foods, are so addictive, they cannot decide. You have to, as a parent. You cannot give them Nutella. They will be addicted within a minute. Yeah. It tastes so good. It's designed to taste so good. It's called man-made foods, and it's designed from chemists who know exactly how to manipulate your neurotransmitters so that you eat more of the shit. Yeah. This is something that you have to understand as the parent. It's not good for your kids to eat like you maybe as a kid, because you didn't know, but now you know. You cannot say, yeah, it's just a kid. No, it's a kid. It's growing up. It's way more important than for you. Yeah.
And another topic for me really important is the connection between metal present in the mouth and the electromagnetic field that surround us. What are the potential risks to our health on that, metal and...
Yes, in this day and age, we have a lot of EMF, electromagnetic field, 3G, 4G, 5G, like everything, Wi-Fi. And when you understand how an antenna works, you know that it's metal and it will amplify all these electromagnetic fields. And if you have any sort of antenna in your mouth, it will just basically change your body electric. And there are people that are getting electro hypersensitive. And again, it can lead to every various symptom. You cannot say it's just the metals. but it could be a huge trigger because of you becoming electrosensitive, because your cells are electrically loaded. You have a plus and a minus. And if you have something that interferes all the time, obviously your biochemistry and your body electric changes. You're not the way you're designed to be. So you shouldn't have any metals and antennas in your mouth. It was different for 30 years ago, but ever since 2008, I believe ever since 1995, we have cell phone like everywhere in Germany. And from 1995 on, all the chronic problems rise. It's a strong correlation between these things. So it's important that you understand the concept of the electric component of metals.
And about the food design concept you talked about before, can you walk us through what a healthy eating looks like for you? For example, just giving some example of a day of eating.
My day?
Yeah, your day.
So I would not say that my food design will probably relate or resonate with a lot of you guys out there, especially not with women, because I eat a lot of meat and fish, and I'm eating super plain.
Okay.
I just love the basics. I love white rice. I love sweet potatoes as healthy carbs. I love my steak, very lean stuff. I love fish. So if I could choose, I would probably eat seafood and fish with rice the whole day. That's probably my favorite. And I'm not a carnivore, so I don't believe in only eating meats and stuff. I definitely tried every different approach to nutrition once in my life. I also tried vegan, but that was the only one I couldn't do longer than a week because I just felt totally wrong. I would say I eat a lot of plants, so there's always some sort of carbohydrates, starchy ones, or even like vegetables are carbohydrates too. So a lot of broccoli, a lot of these things. I believe in a balanced approach and in awareness and quality. So I will always look for farmers that have local meat available, that is grass-fed, so I'd never buy anything from mass production. No mass-produced plants, no mass-produced meats. I try to help local farmers because they will then get more money to raise their animals better. And then therefore, in my opinion, nutrition and food is stored information. That's it.
I super agree.
It's not just macros and micronutrients. It's basically life, energy, and information.
And do you break the rules sometimes, or you love your lifestyle and you stick to it? So
No. It's depending on my goal. The problem is I'm a doctor. That therefore I can be very, very straightforward and strong in my opinions. And I have to, when you come to me and you want to have a result, you will always have 100% approach because I want you to reach the next level. But if you're there where you should be and your health and your gut works again, your immune system is balanced, then obviously it's fine that you enjoy some foods from time to time. So I personally, for example, I eat ice cream sometimes. I like that. But there's not many foods out there that are man-made that I really miss also. So sometimes I eat a few slices of pizza, but I try to get the gluten-free. So for gluten, I'm very strict because I know that it interferes with my brain chemistry. However, if I get it once, it's not too bad. What I probably don't eat is, I try to stay totally away from fried stuff. Okay. And maybe for me, it's more like when I break the rules, I would probably just eat more of everything and maybe try a new variant. So for example, in Dubai, there was this stuff, that mochi ice cream I never tried before. I like that. Yeah. And it was basically, you know what it is? It's
yes, I like mochis.
Sticky rice with ice cream. And ice cream, it's especially Italian ice cream. I love it. So,
but sometimes there is gluten inside in mochi.
With the mochi?
Yeah.
This one was a homemade one, so I especially asked for it. And also there was a dessert which was macaron based. I actually showed in my story, and I specifically asked if there was gluten in it, but there wasn't. So
and with alcohol, when you go to parties, what do you do?
So as you know, I was a heavy drinker as a kid, which led to my problems. So I was really, really strong and good with drinking liters of vodka, no problem back then. But I believe that this chapter of my life has passed. I don't really miss alcohol. I rarely drink, and if I do, it's maybe 1 or 2 gin tonics, but not more than that. I don't miss it, and I actually don't like it. And actually, if it's too much, I just have so much to do on the next day. I don't want to have a hangover. I just wake up in the morning, want to work out. I maybe have a new appointment or meet some nice people. I don't want to ruin any of that life's beautiful experience just because of drinking too much. And probably, luckily, because I already, this chapter of my life has been passed. So I did that a lot of times, so I know how it is.
And I would like to close this interview by asking you, what are your favorite biohacks and what new habit has most improved your life?
The favorite biohacks are always the basics. So if it's just really technical, I would always say the ring is #1. If that's a biohacking device, the ring is called the Aura ring, no affiliation. It's just something that I like to, you have one too, right?
Yeah.
I love to have, what gets measured gets managed. That's Peter Drucker's sentence. And I love to measure things and be able to fine tune it. I'm a really, really precise guy. So whenever I find something new to make everything more precise, I'll do it. So the ring definitely is an important biohack. When it comes to bigger things that you can't do on your own, obviously I'm working on a biohacking or health optimization lab. I told you in the background of my clinic. As you know, we have hyperbaric oxygen, we have red light laser therapy. And what I like to do is stacking these things. The knowledge is in the application. So there will be a new house, maybe the next time you visit or in October, I will have a huge lab in the background where you have all these health optimization strategies stacked upon. What I'm very much interested in is fine-tuning micronutrients or IV protocols, stacking it with the red light or with the laser, low-level laser therapies. So all these really more clinically cutting-edge applications, I'm very much interested. I'm also a big fan of peptide sciences and the use of those things, even though I cannot prescribe them as a doctor. I'm very much interested in trying and using them myself to heal, for example, my elbow. And what else? What else is a good biohack? Every morning, I just measure my blood glucose with a single finger prick, not the continuous one, just a single finger prick. I do my morning temperature. So those are my daily measurements. The ring, finger prick glucose, temperature upon waking. That's basically it. Because then you have everything. You have your sleep phases. And as you know, I also design supplements, and formulating supplements is one of my strong suits. And I'm always working on that one. And yeah, conceptualize things that help the many. So
great.
Combining it.
Yeah.
The biggest thing with biohacking are the basics. It's nutrition, it's grounding, it's going outside, it's food, it's supplements. It's not the technical things. Just when you want to measure something, and biohacking is a little bit referred to these measurements. So everything I do, you could do as a biohacker or health optimization tool. And you shouldn't do everything all at once, but implement things, commit to one thing, stick to it, and it all is about the consistency. The key is consistency. It's not about the thing that you do once. You have to do it as a habit on a daily basis. And the more habits you create, the better your life gets. And it's not discipline anymore. It's just how I live anyways.
So thank you, Dr. Dome, for this beautiful live. I mean, I really appreciate everything you have taught us, and it was a really pleasure to have you here. I will put all your contacts in the show notes, also maybe the Steffi account and your subnutrition also for the supplements, and also your channel in YouTube and Instagram, so people can find you. You are very, very, very active in the social world, so people can really learn a lot from you, from your energy. We can feel your energy when you talk about those things. So thank you very much for this great interview, and talk to you soon. So thank you very much.
Talk soon. Bye, Vanessa. Thank you very much for having me, and say hi to Christina, of course.
Thank you.
Have an amazing day.
Thank you. You too. Bye-bye.
Bye.